Welcome everybody to this edition of the GCI Summit. My name is Aline and I'm an analytical chemist by degree and work at Agilent Technologies as application scientist specialized in LC-based solutions and mass spectrometry. My talk will be leading you through the jungle of cannabis-related European regulations and will introduce you to test strategies we at Agilent developed for you. At the end, I hope you will know about cannabis testing from A to Z. Today's presentation will try to answer the big questions why cannabis products need regulation and why cannabis testing is the according tool to ensure quality, safety and fitness for purpose. We will look at the legal framework and which test requirements are set by the EU. We will look at the cannabis market, which products are regulated EU-wide, and also who needs to test, which will help us in understanding that the cannabis market will most likely follow the standards already set by the pharmaceutical, food, and water industries. We will also take more time in exploring how to test cannabis products and recent developments at Agilent Technologies, which will help our customers to protect their brand and ultimately value proposition to their customers accordingly. Consumers and producers benefit from cannabis testing regulation. Let's have a look at some general classification first. Overall, EU regulations only distinguish between low and high THC products. The base for that is established by the regulation number 1307. Which grants payments to hemp farmers on any product containing less than 0.2% THC. There is a widespread assumption that products containing less than 0.2% THC are not restricted by law and could be imported, used, advertised, and sold to the public. The regulation was not intended to imply that. All imports of hemp are currently subject to an import license requirement and use of certified seed. Hence, also low THC products are restricted by law. These can be products being or containing cannabis herb, resin, extracts, or oils that claim or appear to have a very low percentage of THC and hence which would be unlikely to cause intoxication. The EU has many directives and regulations that may be applicable, but they are not covered by the medicinal law. We will have a look at that in a couple of slides again. On the other hand, the high THC products are regulated by the medicinal law, namely the pharmacopoeias, the EU GMP and GDP guidelines, the GACP guideline, and the local narcotics laws. Consequently, in EU, everything over 0.2% THC is an illicit drug and can't be sold, used, or imported without an EU authorization and compliance to local laws. An example for different thresholds is Switzerland, which increased the limit defining how a cannabis plant is classified under the Narcotics Control Act from 0.3% to 1% of THC. These high THC products can be herbal medicinal products, traditional herbal medicinal products, herbal drugs, or herbal drug preparations. And those can be either made from cannabis flower, namely cannabis floss, extracts, or oils. Up to today, there is still no harmonized European law on cannabis. First of all, the use of cannabis and the response to offenses is the responsibility of each member state. Secondly, the regulatory framework neither defines nor adequately regulates medicinal cannabis. There is still no monograph on cannabis floss in the European Pharmacopoeia. Member states do not all allow cannabis-based medicines on their market. Countries that have legalized the medicinal use of cannabis include Germany, Italy, the Netherlands, Finland, Poland, UK, Greece, Norway, etc. pp. This is a constantly developing list, and this hence hampers the free trade of medicinal cannabis and associated products. Let's concentrate on the high THC products first. As described earlier, high THC products need authorization for all forms of business. It is therefore permitted to grow, sell and import cannabis for medicinal use in most countries. EU-wide, these products must comply with requirements laid down in the medicinal law. As there is no monograph on either cannabis floss or cannabis extracts in the European Pharmacopoeia, the individual supplier may also comply with the requirements laid down in the German Pharmacopoeia, or also any other suitable Pharmacopoeia. But what does the European Pharmacopoeia say at all now? It does describe the test requirements for herbal drugs, herbal drug preparations, and indirectly also for herbal medicinal products. The details you can see on the bottom of the slide. Rule of thumb is that the more complex the product, the more tests are required. For the simplest product, the pure herbal drug, one must at least test for potency, pesticides, heavy metals, and mycotoxins. Criteria marked with plus-minus sign are defined as test whenever required. For herbal drug preparations, there is usually another manufacturing step required. Hence, one needs to test for residual solvents as well. Herbal medicinal products are defined as any medicinal product exclusively containing as active ingredient one or more herbal substances, one or more herbal preparations, or a combination of the two. A list of approved substances, preparations, and combinations can be found online. The same test requirements as for preparations apply. However, when reading the guide for HMPs carefully, the full test panel is highly recommended. In general, impurities arising from the herbal substances or herbal preparation, if they are controlled during manufacturing, it is not necessary to test for these in the HMP. Similarly, residual solvents arising from the manufacturing of a herbal preparation, for example the extract, do not need to be controlled in the HMP, provided they are appropriately controlled in the extract specification. Herbal medicinal product manufacturers must also ensure that they use only herbal starting materials manufactured in accordance with GMP. The regulatory context for low THC products is defined by many directives, which you can find on the left corner of the slide. Overall, the supplier needs to clarify whether the product matches what is claimed in terms of the actual content, particularly with respect to levels of CBD and THC, and whether they are contaminants which can cause harm. Again, the rule of thumb is the more complex the complete production chain, the more complex the test requirements. Hence, also for these products, the full test panel is recommended. An example are CBD oils. Many were found to contain carcinogens, PAHs or benzopyrenes, which were above the maximum levels set for oils and oil-containing food supplement. This highlights the need for testing also for low THC products to ensure quality and safety. The previous slides gave us a good insight into the complex regulations and that it is important to control product quality throughout each step of a value chain. The quality of a starting material will define the test requirements relevant for the following steps. On this slide, you can visually see the complete value chain, highlighting that cannabis testing is relevant for all markets at each of the steps. First point of relevance is already at the seed banks, where impurities such as mycotoxins and microbial impurities can be introduced. Whenever there is a new manufacturing step introduced, the products get more complex and the risk for impurities rise, as well as the need for testing. This is true for high and low THC products, but as well, for example, for the import and export of these products, as there might be different test requirements from country to country. Finally, and most importantly, consumer safety must be ensured, both at pharmacies distributing medicinal cannabis or at retail for low THC products. This first chapter answered the question what to test and who needs to test. Now let's have a look at how to test. First of all, suppliers will need the relevant equipment for testing. This is where Agilent can help, as we provide solutions for the complete cannabis workflow. We have learned that the more complex the product, the more test requirements will need to be fulfilled. As you can see, our equipment covers testing for heavy metals, pesticides and mycotoxins, terpenes, residual solvents, potency, and also microbial purity. Product dependent, all of them will most likely be required. The exceptions are terpenes, which are defined as to be tested on request, and microbial purity is defined as not mandatory, but highly recommended for routine. On top of a pure hardware, we also offer all supplies, a common software platform, application services, and the instrument methods, which are also available as electronic version, namely the e-methods. In total, you will get a comprehensive cannabis workflow. The instrument methods mentioned will, of course, also need to comply to the European regulations. We are currently investing a lot of work to ensure that the method we supply you with meet all the requirements and specifications set, which will consequently enable you for in-house validations. For potency, we established a collaboration with PharmaHem, an ISO-certified laboratory based in Slovenia, which proved our method to be suitable for cannabinoid profiling and validation. Our method for terpenes is compliant, as there are no specific methods, lists, or thresholds defined. Similarly, the method for residual solvents is compliant, as the European Pharmacopoeia doesn't define an instrument method. However, we verified that all relevant components can be detected at the desired limits. Also, for heavy metals, we made sure that all specifications can be met, and we are currently verifying our method on real cannabis samples. The method to test for microbial purity was carefully validated in-house, proving to meet all criteria. The method for pesticides and mycotoxins is really a unique solution and is also unique on the market and highlights very well our effort to supply with verified and validation-ready methods. I want to explain this in more details on the next slides. Why do we need to test for pesticides and mycotoxins at all? Because pesticides are used in the cultivation of cannabis, as well as toxins can be introduced unintentionally, but they are both also toxic and a danger for consumer safety. The big challenge is that they are present in trace levels only, so ppm or even ppb level, and that cannabis products are very matrix heavy, which makes detection difficult. Thereby, there is a current trend that more than in the monograph for herbal drugs defined pesticides will need to be tested. In fact, one needs to prove that starting material was grown according to GACP, meaning Good Agriculture and Collection Practice, and that each step was checked to be, for example, freed from testing. Otherwise, all listed pesticides and every presumed compound that could potentially be present needs to be tested. Hence, target lists will vary from product to product and from lab to lab. Our unique approach to tackle this challenge is to use a combination of gas chromatography mass spectrometry, GCMS, and liquid chromatography mass spectrometry, LCMS, which enables you to detect manifold compounds. On top of a big variety of compounds which can be detected, there is only one sample preparation method needed for both LC and GCMS. With a method shown on this slide, you can also scan the QR code on the right corner to get to the application node directly. We enable you to detect 214 compounds with detection limits of 0.1 milligram per kilogram and excellent recovery rates. A bonus of GCMS is that terpenes and residual solvents can also be detected. As described, the target lists are likely to vary from lab to lab. Thresholds for suspected pesticides not listed in the European Pharmacopoeia need to comply to the EG number 396, or alternatively can be calculated according to the shown equation. Thereby, ADI means acceptable daily intake, M body weight, and MDD daily dose of the herbal drug. We have established collaborations with several labs such as Alcaliba, Lineo Health, and AGQ Labs, which are currently in the process of method validation, also on expanded lists. These collaborations are very good examples on how we listen to customers and adapt to their needs. One of these collaborations examples is shown here. While our official method can already detect 214 pesticides, we have expanded the amount to 250 GCMS detectable pesticides and 266 LCMS detectable pesticides. So in total, 516 compounds. These 516 compounds include the ones required by the European Pharmacopoeia, which are less than 75 in total, meaning a nearly 7-fold increase. To visualize how data acquired with an LCMS would look like, you can see here 3 example calibration curves. All of those show excellent linearity and R-square values. The latter represents measurements of how closely our curve matches the data we have generated. The closer the values are to 1, the more accurately our curve represents our detector response. Let's also talk about heavy metals. For the detection of heavy metals with inductively coupled plasma with mass spectrometry, namely ICP-MS, we are also currently in the process of verifying the method on real cannabis samples. As a short recap from before slides, we need to test for heavy metals because they can accumulate in the plants and are derived from soils and nutrient sources. Similar to what we observe for pesticide testing, there is a current trend to test for broader variety of heavy metals as requested by the European guidelines. With the Agilent method, we enable our customers to test for 25 elements in total. No need for complex sample preparation, and we also stay true to our values and supply you with support to get you up and running quickly with the cannabis analyzer. This is an integrated package of hardware, software, consumables, professional services, and documentation. The key benefits of using ICMS are that it's capable of a high metrics introduction system, which tolerates heavy metrics ideal for cannabis. It also offers interference removal and high dynamic ranges, which means that a single method can cover calibration ranges from 10 ppt to 1000 ppm. Finally, we not only took care to meet all relevant specifications, we are also currently establishing the newly released AOAC method on food products. Let's summarize the goals from today's presentation. Our methodologies are optimized around the idea of providing the highest sample throughput possible, and at the same time we care about addressing the legal framework. Our approach and technologies are optimized to suit market demands with increased profitability as a one-vendor solution. Our application and support teams are the best in the world and are here to help drive customer success. We not only listen and adapt to our customer regulatory needs, we also enable them to be prepared for the future. With that, I want to thank you for your attention. Please tune into other sessions on this agenda for more information. If you have any questions, please message me directly on the networking app. Bye-bye.